Hello, my name is Santen. I'm a clinical geneticist in the Leiden University Medical Center, Leiden, the Netherlands. And I will be speaking to you today about our research on ARID1B related disorder in adults. So why did we want to investigate this? Well, it's very clear from all the published patients so far that the adult population is underrepresented. And that begs the question whether the knowledge that we have currently, whether that also is applicable to the adult population. For example, when we look at things that change over age, such as seizure frequency. But also, it's important because many parents of young patients ask us what they can expect at later life. And currently, of course, we can never predict the future, but it would be helpful if we could at least paint a bit of a picture on what can be expected on average. So these were the motivations to perform these studies. So first, I will be talking a bit about how we did the study. Then I will tell a bit about the medical findings we did. Then there's also a part about the self-sustainability results that we got. So we asked some questionnaires. And I will end with a short vignette about the exon 1 variants versus the other variants. So first of all, the study setup. So the study was performed by Eline van der Sluijs, who you can see here in the top right corner. She is shortly defending her thesis on the topic of Coffin-Siris syndrome. And she included patients who had a causative variant in ARID1B and were aged 18 years or older. And we decided to focus on ARID1B because it enabled us to make the population as homogeneous as possible. Our aims were to, first of all, describe the medical features, and secondly, to look at functioning. So what were these patients able to do and what were they not able to do? If you now look, so she collected in total data on 87 patients. And if you look at the ages, you can see that a big proportion is still quite young, but we also have patients up till the age of 70 years old. Here you see an overview of all the adult patients that consented to share their pictures. And you may see some similarities with your own child, perhaps, if they are also a bit older. But you can see that the phenotype is very variable between the patients. And now over to the medical findings. First of all, when we look at the degree of ID, we can see that this is normally distributed around mild to moderate. So there's a variation. Most of the patients have a mild to moderate intellectual disability, but there are some which only have borderline or even no intellectual disabilities, and some who are severe affected or have a profound intellectual disability. When we look at life expectancy and we compare this to the control population, we can see that there doesn't appear to be a big difference. Of course, there may be some bias in our data because if patients died earlier, they may not have made it to our study, obviously. So this doesn't prove that life expectation is normal, but also based on what I see in the patient, I don't expect it to be severely different from the control population. When we look at height and weight, you can see that the height is shorter than the average, as we already know, and that weight on average is higher than average. And that is something that is different in the younger population, and we've also seen it anecdotally that patients who age, they tend to get heavier. And they're definitely not all of them overweight, but you can very clearly see that it's no longer distributed around 0, which is the average, but it's really distributed around +2. So there is a tendency for too high weights. And if we now look at one of the possible consequences of being overweight, which is diabetes mellitus, we can see that that also increases a bit from the adult age. The estimates 40 plus years are not as good because we don't have as many patients, but we do consider this something to to keep an eye on, especially when patients are a bit overweight. For seizures, what we see here is that actually that the age of first seizure is much higher than we previously thought. So in previous studies, we thought that maybe if you didn't have a seizure after 15 years of age, that it would not manifest. But as you can see here, it is definitely possible to get also seizures after the age of 15. And you have several patients, for example, here and here and here and here, who get seizures at a later age. However, as you know, fortunately, many patients also grow over their seizures, so they don't need seizure medication anymore at some age. And usually these seizures are not a huge health concern. We also had some previous data suggesting that hypothyroidism was an issue, and it does appear to be, especially after 30, that this increases. So this is also something we recommend checking for. Although again, because the number of patients is still low at this age range, we're not entirely sure of these estimates. Another thing we noticed in the adult population is the occurrence of kidney stones, and you can see that this also increases with age. Patellar luxation is also something that we encounter frequently in the adult population, and when we ask for it, you can see that a big proportion of the patient does get patellar luxation sometime during their life. Although again, at the later ages, I'm not entirely sure that this estimate is precise. Now, another thing that we sometimes encountered is the mentioning that adult patients would lose skills. And you can see here, and again, this plus 50 estimate is not precise, but we have a couple of cases where this was documented, and the ages range from 31 to 54 years. And what we mostly heard of was the loss of motor skills, particularly walking ability with increased tripping and decreased balance. But also loss of speech was reported sometimes, and occasionally patients require the use of a wheelchair. I think follow-up is really necessary, whether this is a specific ARID 1B related feature or whether it's maybe related to the developmental issues in general, which may lead to the brain being more sensitive to aging. So now I'm going to the next part of the presentation, which is about self-sustainability. These are the graphs that this is shown in. And as you can see here, for this particular question, can your child dress and undress him or herself? We see here that about 2/3, so 68%, can do this independently. 25% need help, and 7% cannot do it even with help. And so we made the same here for can your child take a bath or shower, and you can see that it's now about 1/3 that can do this independently. About the ability to brush the teeth and comb the hair, you can see that about 1/3 can do it independently again, and about half can do it with help. And also the question of can your child do the groceries was asked, and here you see, it may not come as a surprise to you that there's a big part that cannot do it, but there's also 26% who can do it independently. Some other questions that we ask is whether the individual can go to the toilet, and you can see that 3/4 can do it independently, and there's a small percentage which cannot do it. Drinking from a cup is also something we ask, and you can see here that the vast majority can do it independently. An important question that can also be that whether your child can stay at home alone for 30 minutes, and you can see that about 2/3 can do it, and about 1/3 they cannot be at home for 30 minutes. Traveling by public transport is also something that we asked, and this is possible independently in about 13% of the patients. Then the last part of the presentation is about exon 1 variants in adults. And the reason that we talk about this is because we previously showed that patients with exon 1 tended to have a milder phenotype compared to patients with variants in the other exons. And this is illustrated here in data from previous work. And you can see here that if a variant was inherited from a parent, then actually this is always the case in exon 1. And we have now multiple of those examples. You see also one here, but this was a mosaic parent, so that's a different story, I would say. So now over to the data on the self-sustainability. So when we, for example, asked whether your child can handle money or pay in the store, if the variant is not in exon 1, you can see here that the percentage that can do it independently is about 10%. However, when we look at variants in exon 1, this percentage goes up to about 1/3. So it is 3 times as many. So that's clearly a difference. Also, when we asked, can your child set and clear the table? This is about in half of those that have a variant not in exon 1. And when we look at patients with variants in exon 1, it's 86%. So there's really a quite striking difference in the ability between these two groups. Similarly, when we looked, for example, at toilet training, we see a very clear difference between these two patient groups. So we've also put in the control population, and you see actually that for exon 1 patients, it's not that different from the control population. Whereas for the not exon 1 patients, is actually it is quite different, although this does not reach statistical significance, probably because the number of patients with exon 1 variant is quite low. And when we look at seizures, we see something similar. So we see that it tends to show that the patients who have a variant in exon 1, they are not as likely to have seizures as the other patients. So the conclusions from this work were that there's a clear shift in medical aspects as patients age. For example, the increased weight, the possibility to develop diabetes mellitus, thyroid issues, etc. These are things we don't see in the younger population. We also have now some first data on self-sustainability, and we can see that this is very clearly different in exon 1 versus non-exon 1 variants. But we also see it's quite variable. Again, like of course we already knew, but you know there are for every aspect that we ask, there are some patients who can do it independently and some who can do it not at all, so also not with help. In our paper, we give some recommendations how these findings can translate into care. And regarding the loss of skills, I think this is really something that we need to do more research on, because it's very variable, and I'm not sure whether this is really an ARID1B specific phenotype or a Coffin-Siris specific phenotype. So I thank you for your attention. I'd like to acknowledge Alina again and the many colleagues that helped us in getting this data. And I think if you have any questions, I can send to me through mail, or we can perhaps organize some online meeting where we can discuss questions that you may have. Okay, thank you, and I wish you a very good conference. Bye.